topic here be boy nyina. Inti meda Queens fo nso ase se omo invite me bio. Eni atiefo nyina ne omo a ekire nso ombetie no mesanya me se senya opese atiase no abeboa yen no onye yesa enyumre. Na enyumre nso topic a senya modikan ate no yebesua autism. Na my objective a yedesua enyumre ne se ebeboa yenyina foforo ama yenya entiase a ebeboa yenyina. Na yebesua autism ade a eye ene de enye senya be ya yebehu no kra ewomu ene de enimu enti eno ne topic a yebe treaty enyumre. Okay, me twaso no. Yes, scripture reading me de for addition so no. Yebehu no wa John 9 verses 1 to 3. Sa scripture way I think say appropriate betimi aboa yen ama yehu addition. Or say, as he passed by, he saw a man blind from birth, and his disciples asked him, Rabbi, who sinned, this man or his parents, that he was born blind? Jesus answered, it was not that this man sinned or his parents, but that the works of God might be displayed in him. When say yeshia nyama efa yare ho a ya na ye nipa no ya dwenko ba se ebia bibi ntina eba ne sa na se obi aye boni ntira. Na scripture way emaye encouragement say entisa ye twaso no. Na me pesa me share good news kakra efa de yesia enyumre ansa ne yakọ topic ne mu no. Si ebehu no screen no so nipa bebre actually bebre aye free no. There's a lot of people omo ye ho adwuma pa efa autism eho say ebe raise awareness and say ebe boa omo sa condition no. Na teacher ye krom Ghana center bi wo ho ye friend Hope Setters Autism Center Watema omo ye ade pa na center no enkrofromienu ye frɛ omo Alice Amoako ene Solomon ave mega oma develop anaso ma create app bi a eboa enkra omo wo autism etimi ma omo sua de ema omo timi communicate through sa technology no eboa omo ma omo nimdie anase communication skills ene omo knowledge ekoso. Inti when ye good news my nyina say adikanfo bi wo ho a omo already no omo try say ombeboa oman no anase community no in so many ways. Na center bin so foforo ewo Kumase eho no ye friend care asia chese Center of Autism Research and Education. When nyina koso wo man mu inti very encouraging set afofro already raise awareness provide support emma and kolane families omo sa autism no. Na senya mekaya no, why are we wanting to raise awareness? Say a share screen this me far away free the Guardian newspaper article omo ye wo Ghana omo interview papa bia neba ewo autism and na all share ne experience say adi app na omo develop ye no eboa akola ne pa esan say o use phone no bebre nti phone na o use no chese otimi use no manetimi eboa no sua de instead of say all play games no akola no wo autism na eboa na pa say ema no etimi kasa na otimi suande na areho sema woman say papa ne share experience say so who other parents are omoma no so was center na omo so autism na eboa na pa ma omotimi share our challenges. Na when say fellowship and so eboa bebre. Na quota or kaya say oba autism aya na ase a diminu status and I say a embarrassment. Na ono onyano ohun say it was very difficult say obe accepted say ne bana will be. But over time, titu with sa enyama na omuye was centers ne enyama sa na woshia afofro no eboa ma ne build it up ema ohun say a positive na motivate no managing in a positive way. Oh, let me see. Yeah, twice no. April, World Autism Awareness. Ayana April 2nd. Na omoye biwo Ghana. Na the AAG organization a friend of Autism Ambassadors of Ghana no. Sister Alice Amwakune created sa organization no. Omo organize as advocacy. Ewo Ghana, Nigeria, Eboa, and Senegal, Ekabumu to try to raise awareness. Ewo Africa, to West Africa, no almost more than 400 people participate and I say on my chair to raise awareness for autism. And to when you actually say a idea raise awareness, yes, so I say yes, yeah, family to raise awareness, yes, your community. Titu SDF4 na embo afofro na welcome afofro na emfa support nso ma afofro na embo your communities no na nipa or participate na or kaho bi no or trust or my quotation say or say it empowers people to take information omuhunu wasa awareness day no ekoma afofro ewo neighborhoods and no communities se na ebeboa na ankoye stigma and asa taboo na amanfo ka ho asem na omunya emwa no a ebetimi aboa no and it helps people understand say it is okay say oba will be there's so many ways that obetimi aboa kra no to live in a successful society. Okay, mama introduction what is autism? Autism krankasano, what is it? Okay, definition is very broad and general. Dear Mifko CDC for website any Mayo Clinic for now my definitions I think say bebwa. Autism nankasano, the formal word, another formal name, autism spectrum disorder, ASD. Almost a developmental disability caused by differences in the brain. Now, some people with autism no have a known difference, such as a genetic condition. Omotimio say toda a genetic. A hona CDC for edemaye. Now, Mayo Clinic and so say autism spectrum disorder, a condition is related to brain development that impacts how a person perceives and socializes with others. It causes problems social interaction and communicating with other people. Also, the disorder also includes limited and repetitive patterns of behavior. Autism no. Enye adie baako netimi ema wo say we your autism. A group anase a pattern of behavior. Doctors anase specialists for etimi diagnosis say we your autism. Inti se obi ewo adie baako ebia one characteristics it doesn't mean say ampa or autism. They have to analyze it in so many ways. But that is the accepted definition of autism. What it is really in the brain development. Now, say I shared the term spectrum. Spectrum, no, I am not a range of disorders and I say symptoms are what along what spectrum out ebia akolano and I say penimono ojina. Autism, no, there is mild and then there's severe. In the omuka spectrum, I mean, say, ebia nipano on the spectrum, no, ebia our mild symptoms. And I say, obifu fronso on the spectrum, no, our severe symptoms. Now, the symptoms could be so many things. It could be depression, attention deficit disorder, just on to me, tembiano or move around. I said, why you hyper? And I said, or oppositional defiant disorder, and then ODD, no, just a tembiano or you're aggressive on to me and follow directions. And in Yama be brave. But it doesn't also mean say obi wo autism na ne intelligence low. If binum timia gifted, senya they can have high intelligent your friend is saying ability, intellectual ability. Inti ebino mo ho a omye sena me kan no mild symptoms no omutimi high functioning ebi kra say when you're very familiar who say autism, and of course someone we severe no and no very noticeable. Na enkola, it doesn't mean say enkola nkwana etiminya autism. Empenimun so also omutimi de nini inti etimi yehuno wa etimi huno wa empenimfo no musumu. Na ade ba kwa yehu say omo autism no, they have a hard time with sensory processing disorder. Meaning say sensory and nyama omu feely, omu hia, omu tasty. It's me omu very sensitive. Ebino mohwa on pet loud noise ba no akata na so. Esa say disturbono. And now certain smells, they don't have boundaries, spatial boundaries. Not they smell people and not say objects because sana omo interacted with omo environment, you know. They don't like to be touched. And I said, oh, Shana Tadia, they want to wear the same clothes. They don't have body awareness. They are very clingy to adults. Almost trusted, almost tie and quote ni pafu front chain. Almost to me, a picky eater, just a nya jane biana, omudi. Almost so a be almost to almost to me, clumsy. And I said, almost to most of the time. And I said, almost smell something not a disturb almost. They could your friend is saying, to me, I rebel against brushing their teeth and not combing their hair. It's not said they are very sensitive to environments and they don't want to be overstimulated. And yes, they'll have a meltdown. And then sometimes, you know, idea about which doesn't mean say oba and until one and so I mean so autism. Senamekayan is a group of things specialists. A specialist but the diagnosis. But in Kwande Biwa I said they're walking on their tippy toes. The 19 kafum. Into usually they are usually on their toes instead of something anti flat, you know. Into when you know idea you bet me who ewo and kola omo autism no. Nema overview no, general overview no. Inti senamidi kai x-ray no, autism a spectrum of conditions. Inti anya ade ba ko ene betre ebia nyama bebrea ebia wo parents washanenso na wehu. Na previously no, na almost refer autism to Asperger's syndrome. But that terminology no, I'm saying no ya fade. So generally no be or was a mild end of the spectrum no, of autism instead of the severe spectrum no. Inti, when does autism occur? Usually no, it begins early in the childhood. Aya na you can, as a parent, you can see some signs early on between 18 months to 24 months. Time developmental period, no. Ehono timi hu ebia signs and symptoms a say ebia krano will be anase onibi. But oftentimes, within the first year, utimi hu. Senya osi interactive with school mu. Anase senya interactive with the environment, but it doesn't mean say all the time. That's when it manifests. This is just usually, most likely, but it's not all the time. Now, when it's to me happen later or earlier. See, share statistics about the Ghanaian community, Unfortunately, no statistics for Ghana and any other African countries, and sheda ni ho papa. Study back suggested share the prevalence of how often it occurs that almost say 1 out of 87 children under the age of 3 in Ghana is autistic. But American statistics but this is bakwa mihu here. But sure globally, almost say 1 in every 68 children have autism. Now you share US Hanswa 1 in 44 kids are identified as autism. Now statistics in 2000 shows say your friend is saying usually boys are 4 times more likely to be diagnosed than girls, but it doesn't mean say a man have autism more than girls. We're just talking about say and then it says although autism can be diagnosed before a child reaches the age of 2, most kids by the age of 4, not just say a daddy. Now, autism, 40% intimin kasa, only a nonverbal. Now, 44% have an average or above average intellect. Sena mekaya, and yes, autism, you can be extremely brilliant and have autism. And that 31% have an intellectual disability. And they can be disabled intellectually. But the positive sign is that 44% can have superior intellectual ability. Now, the interesting thing is that US, California has a higher prevalence of autism. Now, I'm not sure why, but South Korea, so when we look globally, almost a high prevalence. California, 1 in 26 children, and South Korea, 1 in 38 children. Internet, and when he said, topic way, now you raise your awareness. And said it's not like say in autism they can't function in society. So now make an ebinum your mild with just the support and the resources no to me I live a very productive life omo. See, autism, parts of the brain are affected, the kind cerebral cortex. Send a mechanism in layman's term, the thin layer a cover brain. Now, the important about this area, and say a bois for higher mental functions, general movement, perception and behaviors, and not a control sanyamano. See, the next one basal ganglia, and also a bois regulated autonomic movement, and nyama movement automatic, but you are able to move. The corpus callosum, also a bois, it connects the right and the left sides, a bois communication with others. And on a control communication, the cerebellum also a control balance, body movements, coordination, and the muscles are uyusu edikasa. The brain stem and also control primitive functions are very critical for survival and now for living. Ibinese ohume and now okuma pompo. The hippocampus no ebwa Emma ukai information and I say inventor esi na ebwa memory and the amlagada no and how you're responsible for your emotions and also includes your aggressive behavior and so obi autism no ayana it surrounds this disability intimi mbwa momo intimi control those basic functions na makeka no. Inti ya twaso no yenhwe myths around autism no. Sena meka for the Ghanaian community and I say African community no. Aya na yewo misconception say autism ebia be na say bibina obonsambina opano. But entisa diagnosed conditioner so the core specialist who anasa doctor who umbetini ehu at the chrono. Another myth ne say autism new and yanokre. Actually autism has been around for many years. Senia additional reno. Another myth ne say autism a mental disorder and I say wadrimu kikawa and I say how and yanokre a neurological disorder senia mekano. It deals with the brain structure. No, there's abnormalities at woho. And ayana it manifests in developmental disabilities. Inti and shadanya mental health issues. Senamekai a neurological disorder. Another myth that woho say all individuals with autism no mental disabilities. There is different severity and degrees of autism. If you know only a high functioning and I say almost very mild, they will not even manifest any mental disabilities. Inti, so a very intellectually high functioning. Inti na meka say you can't just say so and you'll be amunina. The other myth is that autism is caused by vaccines. Way, it was a huge issue. Not mothers, maybe some time ago. Not they were refusing to vaccinate Omamano with measles, mumps, and rubella. And I said vaccinations like Yedema and Polano when they are growing at different milestones, no. Because no more drains said vaccines not cause autism no. But who said there's no evidence that links childhood vaccination to autism. Inti sese no is considered a myth. Another myth is that autism is caused by poor parenting. And correct. Send a Bible quotation na medema no. And yes, mame ayabone and I say papa ayabone. And tisa, it is a neurological abnormality itimisi. Though the exact cause and yet 100% no, where you dear omashadashia omodi omahu, but it has nothing to do with your parenting style. Another myth is that autism is caused by environmental factors, solely by environmental factors. And yes, they were home and I said you did and a man autism. Some of the autism has been linked to genetics. It doesn't, there's no research right now. I suggest to say environmental factors etimi koso and non etimi koso autism. I mean kanisa. Another myth is that individuals with autism are violent and tisa. Ibinum etimi calm, it's a very quiet functioning life, and that's a quality of life. I'll say another one is people with autism lack empathetic feelings. And tisa, autism doesn't mean say untimi empathize with someone. And I say you're cold, uni feelings. And you're not correct. There's so many other myths, but that's usually the most common ones. Ayana enipa eka. Inti enede me pesa me say it's all a myth. Say you are all these things, and I say only feelings, and I will be sad if you are autistic, and you're not correct. So just to summarize a whole yes, you who say autism a neurological development difference. It's all about the brain. Senya, your friend is saying, brain development, and I say disorder about your neurological development. Now, also, no, it affects every individual differently. One person, it's not one size fits all. Obia was senia, obenya, and a spectrum, no, so it be a mild, it be a severe. Say, no, there's no cure for autism, a lifelong. And it's a nipano wa, right now, no, there's a cure for it. Inti say I caught through the myths of autism, no, see shared the causes of autism. Senya mekaya no, the exact cause, no, right now, no, research, no, omu exact cause. It's really unknown for now, but most of the research say it can be multi-factors. Itimi ede autism ba. Ebetimi the age of the parents. So omo ye older, older parents are omo wo akola, and I said they could have low birth weight, metabolic imbalances, exposure to heavy metals and environmental toxins. Ebiad, mamino no onyamno viral infection. Some exposures to medications are emboa to set the litamide, to say gradient. For a long time now, no, they have not, if you're pregnant, they won't give you that kind of medication. And now fragile X syndrome, and no stress a genetic passed down from parents to the children, it's cause intellectual or developmental disabilities. And tenya adeba a nyama be brain cause autism. Now, Senya Mekayano, a lot of studies have shown say the age of the mother and the father, titu say yamo first child, and no to me increase the chances of having an autistic child. But Senya Mekayano, there's no known cause. Say say we pa cause. So this is just researcher omo ehun. Symptoms of autism, no. You wanna say omutiminya a lot of symptoms. Etimi show language impairment. Ebia we di and fear ebia true on timin kasaye or make sounds, but on timin kasa. Omutimi anxious, agitated. Esa so on timin kasanso. Na amanaye agitated. Itimi omutiminya severe constipation, omutiminya seizures, omutiminya aggressive agitation, anasa hyperactivity, omutiminya enyama bebre, omutiminya nonverbal communication, just say ontimi expressing a home, ebia or repeat. In behavior. And I said only interest, ubonidin cry, amanaye very independent. Level 2, no here support more support than level 1, of course, with social interaction, send Americano, eb 102, ebiane repetitive behaviors, nenyamasano, be here resources and asset therapy. And at level 3, here a lot of support, substantial amount. esan se or severe deficits was send obe kasa and now say obe interacted with others and also be focusing. So I shared the signs of autism. Send Americana it's not say a deba coupe na say who we are. You have to jump to conclusions. You have to get it diagnosed. You have to go to a doctor specialist, not omomwa. But some of the signs, ebia akolano, ontimi and yet eye contact or avoided eye contact. And I said, odi agra onon kwant midi na grow na or line up objects or pese bia in order. And I said, send Americano or you're very sensitive to noise. And I said, your friend is saying the environmental woman. And I said, if you're sensitive enough, or don't object is all different in China, or be so and I said, or be aggressive, or hear more rest. And I said, they always do repetitive movements. They be a movement bakuna or yenesa twatwa susa. These are some signs, but it doesn't mean say akulaya bakwa all of a sudden or autism. Yeah, they prefer to play alone. He doesn't want to share with others. On pese obe share a favorite toy. On pese obe interacted with other people. On pese obe sonemu, on tinu spatial boundaries. No aben will be brave because on tiasia you don't go close to people so much. And or you're comforted by others in distress or trusted nebusian kwana cinema menene papa, just few people or interacted with. Sometimes they don't have any expressions at all, facial expressions on slit, and yamasano. And say oh yeah, baby or ubonidia at 12 months a kolebia senka or recognizing the dean. But and call more autism no ABA on recognizing it in tubonidin cra on responder. So now make kind of patterns of behavior with eye contact, facial expressions they're not make kind of before or line it up in yama or to organizing yama sa or percenting straight and now say organizing in a row. But so now make doesn't mean say yes it means autism. It's just one of the things that ABA or expressing emotions in a way healthy or soon or tientiamu or the pia is hard because on who say a PMT said they don't understand social interactions and I said social atmosphere and I said social environments indeed. ABA were inappropriate expressions during different times untimin control so who when said you need to share the concern now you want to share the concerns with the doctor now you're open and and to set it to na first na taboo and I said oba ewo condition be a person be able there's all this support and resources ubitimi ediabo akolano. Typically a team of specialists and a diagnosis of autism it be a child psychologist, occupational therapy, speech therapy for and a doctors when you kabomu ebwa ema omutimi hu adekrono. TCA treatment say for autism and yet adeba pena or treaty and not the there's no cure for autism. But they do different therapies it be therapies need to to help them with their behavior. It be with addition and I say learning. And they be no medication be as a hyper no to prescribe medication. It be a physical therapy, it be a social skills training, it be a speech therapy, it be a nutritional therapy, early intervention, just a men train whenever you see say concern be what catch a doctor nentem no muntimimboa akorano. One of the most common therapies ABA therapy. ABA no asiache say applied behavioral analysis. And no a group of treatments are omoye from krano to use positive reinforcement. Senebeya ma akurana ye the behavior na omopesa akurana ye no. Bia or preventing a say prano home. I deal with autism kids maybe more on the spectrum now. They don't understand say bia me chumeka metime pra. Inti they usually are at risk say omobepra. Inti eniama therapy ne boane say omo boa akurano to be able to interact with the people around them and also in society. Senya beya omo prepra. Now the impact on the family is huge. Mede eba ewiano. Se abusia dealing with autism true. Intina ye raise awareness no senya beya more accepting and tolerant and understanding. Esan said there's a huge impact abusiano. There can be some embarrassment abusiano will feel. And I said enyano will feel say teachers about kuno severe autism. They could feel some embarrassment, you know. It mean limited parents no they be almost me cause I say the akwano pia ayana controlling akwano ayana editing. And some parents maybe also they feel personally responsible. Say, did I do something ema akwano? It turned it out like that and I say parents maybe more other children it's say we hear more attention and I say we hear more interaction to control akwano not other siblings they feel it ignored. It can also have some financial burden abusiano and our phone so it me breaky family no anasta our and it's say a distress about our anymore when you're dealing with this type of condition. And families nibo honswa a sign of how ne and yama bebrea so mu pia na se omo interacting in a social event at the baninti ayana omo nkobe bia na chese oma cafe. Inti when you ya dia yebetimi abua families are almost go through sanya manina to help them to understand say autism at this time no and yet taboo to say first no yeah you say you know your culture no obi wo disability and I say bibi sana ya na ebushane mpese be pie esan say it can be as if say ebushane e wo curse and I say bibi na aye ebushane ntina bibi aba na sa na say ema aware into sa ebushane kra eho yedin nti now na ye koye nim na say ye boama obi ati ase say enti sa a conditioner obetimi enyamoa enya resources ama akra na timi enyi a level with sa condition no etimi aye productive member of society nti menwasi dishana no so be what questions and comments or betimi ediaba abua entiasie aba. Thank you.
Yo ebusiafo ebede yakopon ase pa se onam Dr. Freda Osei amaya. Doctor also yame nshira. Na my miss a quick question. Yame ma ho kwan a next wait me aba now because it look as say your time I can know is now I'm afraid to say make say you miss questions there in the wasted time in the but maybe some question anyway but maybe say the next yame ma ho kwan a say your throw wait me aba.
Yo, yes.
And the middle as a far,
that's what I say.
Yo, ebusiafo yebede yakopon ase na ebisaka doctor so ebe no asembusa ene emboa be na yedui na medika kam so yanko do redu so ababedu so ene ntino today the mechano, we no person will come back, look at you now, go YouTube, and I say CB radio. Now, what's a equity as me for? But I must say, anything as in with her and I say more, so go out on camera, 9 to us. So, I must say.
You, doctor, maybe said I'm questioning a multiple symptoms are all associated with a diagnosing autism. Now, me pede be so that a common one CBR on the all round through all types of autism. For example, some time ago, we shared a documentary about some young neurologists CBR. Now, we'll try there. We'll try early diagnosis. Now, one thing that will come out with there. A number from a way, they find it very difficult to use their hands very effectively. And see, there may no crowd try one there. They gravitate towards a autism. Now, another thing, so we in there. So we don't want you. Now, they don't respond.
Yes.
Something like that. A few common trend initially
Yo, Ms. Medase, that's a very good question, opinion. Thank you. There's some common things that Senya Odi Kai run it through autism. No, most of the time na ayana omunim Senya metre in the other slide na about how it affects the brain. No. And my brain and control different things. No, that's why Oba Kolane Dinya won't me recognize it because and it's not I said a honoye disabled kakranti on yet on recognizes wabonidin. And since a neurological disorder named T omo movement send out cannot say on Timimu using and sano their movements no. And hono I affected, so muntimin control or movements ni ye. Ebino mohonswa, they are very, very sensitive to noise. And now say, internet picture na bakuna medeba and akulana sona sono. So some of the time the therapy ni biwa ya momo headphones eshe. I bet me abua or to reduce the noise a walk around the surroundings. No teachers are collaba sorry, I only say Ghana for ayana, a sorry piano, ya tonyom, ye say, ebi akurano, and you're comfortable, send me papi prewa around, and I say ye did this and tea on peso betna a soin dynamo. So there's different things, but men pese may say because obia dear different. So nipa me no autism, you won't see the same thing in both, but senya kind there's something common ABA Oba Kolani Din who senya or react in public. Idea, you think say or reacting too much or you're too sensitive. ABA or before fraud is not affecting them that way. And yaman people have them our concern. In America says good so no Dr. Becca senya ufi say akule aden bibi yeah koswana sa concern no sa doctor no na man kumu. But yes, there could be some common things ewoho.
Yo, that's it.
So that's yes.
Sure, Mr. Aqua.
Okay, now the question is, but your doctor say, according to medical school now, we have say secondary school, Kenya autism na say, when you saw a home ayarsa and a draw.
Secondary school, high school, boy.
Yes.
Yeah. So yes, enyam kolanko na timi ewo autism. Be a senior high school ni no, secondary school no. Na ewo hodada be a ne de ne da very mild enti. Oya akra no omanhu anase omobo amane so. Enti waye high school no be a enyama bi a oye no. Yetimi ka se akola is the age no senior osi act no and the age nenko be a act lower than the age. Enyama ni bi wo ho a or act to said the oya abofra. Enti be a it was overlooked or ya crown and yen ena wabeye opinion yen but it doesn't mean say be or yeah opinion on a buy. There was something there ena I go undetected sa no abenyin na abia apie a bit said yeah send America no we secondary school graduate I we feel say at this age na senka we behave say but to be one ne age no ne senior or see act no na enenenko ebia or behave younger than the age,
Yo, now the second question and they say, I saw one what doing so.
Oh, additional say no, ni cure. There's no cure for autism. Just therapy. Therapy on me depending on senior akrano. Sena meka in a spectrum. Say a shred line, you start to her, na end her. And chronic be home very mild. Inti no, and yamaka crebina, ombetimi therapy, a beboa crano, ubi a creme. A binum so a wamu and fin, a binum see very severe. Omwa, bia, omo fin na, omo here and more with speech therapy, no, ombeboa with speech therapy. Bia omedi DNA yet into omeboa with nutritional therapy. Senia additional chere no and yes a cure but a boa akrano with the hanono. Say yes speech ne kasa and yet say a ye addition onim senia 6 year dear say yes social interaction omutimia therapy say omuma akrano skills cyberbuano to deal with socially. Ebia on any pabe interactive. Nti those things na omutimi yema eboa akrano timi eshia ehunu na oye more independent in society, but there's no cure.
Yo, doc, I'm sure that's it.
That's it.
No, from for her now.
Yo, doc, I'm a miss away. Young cultural practices, osidana, or hinder our ability to handle these situations. Ghana for they depend on our member. We don't want to change and not adjust our member to deal with situations like that. And zaman or when young cultural practices to increase and all sorts of form interaction or handling this situation much better.
Thank you so much. That's a very big question. Entina, addition, but say raise awareness. Ghanaian culture no. Send a mekaya no. Your old ways and I say your culture no. Just a crana bibi say crampona and per se a boss of cram or be crabbing home. And so not prevent your crano from getting the therapy now uhiano. Right now, no, I say you accept it. Na more welcoming, so be where you're sorry more, and also be where you're bushing more. Accept you or come my and chain, in the way we can. Na feel it say, be a stigma, and I say, your friend is saying, outcast. In tears, a set, send a kind dear, no cray woman, dear, and I said, be ye na you be an asset. Obi akoye bone anabibi sana when ya timi yopia anybody. Enti the ever preventing and to get the help and our therapy and say money okay na enya acceptable na my kasa negatively on those people omo bi anasa mabushia send a bay on bebo matimi a bang, you know, now manya support and I say and moi a bebo woman. But I was very encouraged. Send a meka in the beginning of the program. They said Ghana class is say no omo ye nyama bebre a raise awareness and tia no so timi boa ema exercise culture no. Send a meka and they had the World Autism Day ewo Ghana, Abra, Nigeria, and Senegal, you know, ebeka ho to do sa program no. And the two schools and answer centers Oma peja wo Ghana no bako wo tema bako wo Kumasi no boa training you know enkola omo autism no we nyina boa na yen so ya sorry no no yen mwa yen kekan call mo yen chere omo do say na be ya families no so be feel say you know omo you supported na omo nyes different so we nyina boa that's it.
Yes, yes.
Amen. Yo, Abusiafo, say your brain I break me, Nimade, to do a quick question. Remember no quite now, essence say I'm in my home choir. Now, what you said, Dr. Bebsa Banafi, already over other kind of one thing, Nakame says, a bit me, correct me, more question, they say, maybe you have, but what? This is a young point, and it's the better I'm in my home choir now, to send it. Now, there is a question, it is another. It better also, sir. So this answer there now person be a quick question. The memo now answer doctor or the final thought about we are my missing here this wild bumpy extra so Madam Master. Okay, doctor, Pacho, final thought after my enough my missing here John bumpy extra.
Yo, me that's your opinion. My final thought, ne say, and you may share autism, the woman, the animal, and yet a yarabia, as I said, a boy who say a bay year, and I say a curse bina, I any pano. You who say, yeah, my Ghana, and nay, cum hanebe, bia, one sending dear, ebecon and name for autism home. Na yamwana sankra no so mwanya the therapy betimi aboa wo ma function e wo society mu omo therapies bebre enti yen raise awareness ni yen chira foforo so bi wo sate bi mu anam wa omo no mwanya help and support na ya sorry no so ye betimi a chire odo e ma families omo go through such challenges no enti enumere madam ase se mo invite me